Thank you, Dr. Perry. We really appreciate you taking the time to meet with us and have this discussion. You've had a huge influence on the work that we do at Hull and in Alberta for the past, what, 20-ish years or so?
About 20 years, yeah.
Yeah. So we'd like to take this time to really talk about the pandemic, COVID-19, and what's been happening in Alberta and all over, really, to be able to kind of understand where we need to go from here. So, if we think about what people are saying and how people are perceiving this, a lot of people are basically talking about COVID-19 as being a uniting issue, right? Like basically everybody in the world is going through the exact same thing. And we know in the field of mental health that the impact of this is actually going to be quite different depending on who you are, where you come from, what your background is, and things like that. So can you take a little time and speak about what kind of things we might want to pay attention to during this pandemic in regards to that?
Sure. I think everybody's probably heard this by now, but I think one of the phrases that really captures this a little bit more accurately is the saying that we're all in the same storm, but we're not in the same boat.
Yeah.
That there's some people that are, they're more resourced. They've got more space where they live. They've got access to nature because they can go out in their yards and there's, it's pretty. And they may live in a community that's not as densely populated. So, it's a very different experience if you are living with 3 or 4 kids in a 1-bedroom apartment and you're getting 3 different versions of how you're supposed to be teaching these kids because they're at different, in different schools and at different grade levels. And you're supposed to be working from home and you only have 1 computer and you have sort of a sort of access web service that's kind of spotty. You're not in the same boat as somebody who's got fiber optic cable and multiple computers and no children at home. And so it's not really the same thing. And as you and I know, I mean, we work with families that tend to be resource challenged anyway. We work with folks that tend to be marginalized and struggling with histories of adversity, trauma, a lot of immigrant families, people that have already had all kinds of challenges. And then adding this on top of it isn't, that it's a big burden for a lot of folks. So that's part of what we're trying to pay attention to is how are those families faring? How are our child welfare systems sort of meeting the needs of kids in foster care? How are they responding to calls? How about families where there's a domestic, conflict or even violence? And I think everybody's sort of been following in the news, both in Europe and in the U.S. and in Australia, that the rates of domestic violence calls have been skyrocketing.
Yeah.
So there's a lot of there's a wide range of experiences, and so on one hand, and we talk about this a lot, is that different people have different capacity to kind of manage stressors or challenges. And some people are kind of over on one end and they're pretty flexible and they're able to demonstrate what we call resilience in the face of a challenge. And basically what that means is that you're able to sort of meet the unexpected stressor, and after you deal with it, you get back to your baseline. But when you do that, even if you're well regulated, even if you've got all these gifts, if you have to do that again and again and again and again, it wears you out. And so you may be over here on this way over on the resilience side of this continuum, but if you have nonstop stress and challenge, you start to get worn out. And we're certainly seeing this in a lot of the healthcare professionals who are in the midst of trying to address the challenges. And again, there's tremendous variability. In some communities, there's hospitals that are not overwhelmed at all; they're empty.
Mm-hmm.
In other places, they're making decisions about who gets a ventilator and who doesn't. And so, I think what we're seeing is that some people are getting completely worn out, and some people are getting challenged, and they're bored and they don't like to be at home, but it's not the same thing.
Mm-hmm.
And then the people who started out this whole thing over here, they're just getting completely smashed. And one of the things about these big events is that they magnify the fault lines in all of our systems. So if we had a mental health system that was, maybe not the greatest, and I hate to say that, but our child mental health systems in North America are terrible. There's long waiting lists, all kinds of kids are underserved. And then you add this to it, it just makes that even worse. And so, I think a lot of our systems, our special education systems, our mental health systems, our child welfare systems, our home visiting programs for early childhood, they're all really being stretched. And, we and everybody who kind of works in these systems, we've been trying to figure out how to meet these challenges. But because the challenges keep changing, we have to go through this process of problem solving that's nonstop problem solving. The situation today is different than it was 4 days ago, which is different than it was 3 weeks ago. And so what happens is you get what we call decision fatigue. People just get completely worn out. And it's Tuesday. Today's Tuesday. Yesterday I felt pretty good. I had a nice weekend, but I woke up this morning and I was exhausted. It feels to me like it's Friday afternoon.
Yeah.
And I've got a whole week ahead of me. And I'm dreading it. I'm like, oh my God.
Mm-hmm. Well, and a lot of the things that you're saying, we are trying to address as much of the needs of our more vulnerable population as much as possible, right? Like our school was fortunate enough to be able to keep the educational assistance despite all of the financial cuts. And in that time, we've been trying to think past what they might need in the classroom, obviously, because they're not there anymore. So one group of the child and youth care counselors are actually working specifically with the teachers to develop more social emotional curriculum. So what does that look like at home? What are some of the kinds of things that you can do at home to maintain how regulated the kids are, how regulated the parents are, what are some fun things that they can do? So really trying to keep them socially, emotionally regulated. And then another group of our child and youth care counselors is working specifically on making sure that the parents actually have that the kids that are in the breakfast club and the lunch club actually have the meals that they may need, right? So our child and youth care counselors are literally making lunches and dinners and then bringing them over to the families. We also recognize that these families have, may not, like you said, have access to the internet. So may not have access to printers. So some people are actually printing off the homework that the kids may have and bringing them to the homes and things like that. So just really kind of paying attention to some of the other needs so that we're not just addressing, okay, it's online school and everybody try and deal with this online academics for the kids. So I feel like this has been a part of us paying attention to some of the trauma-informed care things that we've learned from our work with you about what some of these families might need. So that's definitely been helpful for us in that end.
So how are your staff finding distance therapy stuff? How does that, are you guys doing some of that?
Yeah, so, our TCBC, the therapeutic campus-based programs still have to be on campus. Obviously, the kids live with us. So there's been a bit of a decision that people go home and then come to work. And, obviously everything's kind of closed down anyway. So that's what the expectation is that there's very minimal contact. And then the people that are in the communities are really trying to do as much of the online support for the families as possible. But even with our interdependent living program, one of the things that the counselors are doing is we're going to do a cooking class for the young adults. And so here we're going to bring all of the ingredients over, drop them off at the front door of your house, and the cooking class is going to be on Zoom at such and such a time. So really trying to be engaging and creative as possible. You know, we have been trying to provide some therapeutic interventions as well for the families, and you know, some group therapy and some individual therapy as well. I think it's not quite the same obviously as being face to face, and you know, certainly when you've talked about things, I remember myself having that feeling of, okay, so we're talking about social distancing as they came out with the term originally, right? Social distancing. And what does this mean? Everybody's going to think that we can go online and have the same impact as we would, you know, face to face at a conference or whatever. Like, I actually started to worry about it. And then you started to say emotional closeness, and, you know, let's maintain that emotional closeness. So if we were to kind of think about that emotional closeness, how would you, looking into the future and, you know, making sure that we maintain that, what do you see happening as a result of some of this physical distancing?
Well, you know, I think a lot of people in their everyday life take relationships for granted. You know, we don't really notice the power of the relationship and how what they mean to us until they're gone.
Mm-hmm.
You know, it's like the Joni Mitchell song, right? Good Canadian, right? Uh,
Right.
so, and I think what a lot of people are consciously aware of now is the power that just being with other people in the same space can have. I did a webinar the other day with Kay Warren, and she was talking about her granddaughter, who told her in the beginning, she's an 8-year-old granddaughter, said, "Okay, I can handle being separate from grandma and grandpa for a while." And then but then later on, she said, "I never realized how much it would hurt, and to not be able to hug people that you love." And it's true. I mean, you know, the people that study the biology of human connectedness will tell you that the deprivation of physical contact is distressing / painful. And so I think part of what people, you know, one of the things I think that can happen from this experience is that people will maybe be a little bit more conscious and intentionally deliberate about the way they reach out to other people. You know, everybody's got friends or family they don't live with. And we kind of have this day-to-day inertia. And then, you know, after a while you realize, wow, I haven't talked to so-and-so for a month.
Mm-hmm.
And so I think one of the things that we've been trying to get people to do is to just literally make a list of people in your life and be really intentional about calling them or reaching out to them or texting them and asking them, do they want to do a 5-minute Zoom just to see me, your face? And, you know, that kind of emotional closeness, it doesn't replace seeing somebody in person, but if we're more intentional about it, it can really tide us over. And I think when this is done, I hope that people are more intentional about, you know, really reaching out to those people in their lives and connecting with them that they may not see day in and day out. Mm-hmm. And so I think that's one thing that we've tried to, both in a workplace, you know, a lot of the people that we're consulting to are in the healthcare system. And in a lot of our systems, supervisors do not tend to go interact with supervisees unless there's a problem. Mm-hmm. So you go spend time with somebody when they need supervision, right? Or they need coaching, as opposed to reaching out and going, how you doing? And what we found is in workplaces, if you a couple of times a day reach out to people that are working with you, not to sort of correct them, but to just check in and see how they're doing, it really builds social cohesion. It makes the people that you work with feel safer. They're more productive. And again, I think that this is an opportunity for us to kind of teach other people about the power of relationships and how to intentionally bring connectedness back into our lives.
Because the relationships are really going to buffer all of these adverse experiences. So when
Right.
we're actually looking at a situation where people are required to be physically distant, and as you were saying, there is a need for that human touch. I mean, I remember experiencing that when my daughter came home. She said, not touching you, not in, nobody's getting close to me, I'm going straight down to the basement, whatever. And she said, besides, a hug is just a few seconds and that's it, so we're not really missing much. So she goes downstairs, gets herself, and then she has to deal with all of the emotions of coming home and all the stress about flying home, her second or third time on a plane alone, right? And dealing with COVID-19 and being afraid of everything else. So it was during those times that I really noticed not being able to touch her, right? So for 2 weeks, we
Right.
were not supposed to have any physical contact. And it was those times that she was having those periods of this, I can't believe this is happening. I can't believe I'm home. I can't believe, what if I have COVID-19, or what if I spread it to somebody else or brought it home or something like that, right? And not being able to have that physical contact. Just really challenging at that time. So, and I would imagine that people are experiencing those ups and downs all the time as we're going through this, right? So,
Right. And I've actually heard, related to that, one of the, I think, most painful things is when people are sick, and sometimes when people are dying, where we've not allowed their loved ones to even be with them.
mhm,
And the challenging thing for the healthcare professional is what we basically can call a moral injury. They have to watch someone die and talk to the family members so they can say the last words, or they can have the last FaceTime with somebody who's on a respirator. And it's brutal for these healthcare professionals. It's a moral injury occurs when you observe something that is painful and you are helpless, and you can't do anything about it. And so this is one of the predominant elements of the distress for healthcare professionals, is just the sense of watching these horrible things happen and you not being able to do anything.
yeah, so helpless.
Yeah.
And this kind of brings up some thoughts that I have, that I was, in regards to, you've said in the best of times, and we all know this in mental health, predictability, structure. But you've already said this too, that there's just not a lot of predictability. There's not a lot of structure. Things are happening just like that. Like
Right.
suddenly borders are closing down, or something happens in a congregate care setting and everything just explodes, and all of a sudden you have to do things differently than you did before. How are people to be kind of managing all of this uncertainty, and what are your thoughts around that?
Well, we've talked about this a lot before in our work, that when stress in and of itself is not necessarily a bad thing. In fact, stress is a part of everyday life, and it's actually a pretty positive thing if it is controllable and if it's predictable. And so if you have the everyday stress of going to work and giving a presentation, and you master that and that goes well, you actually develop resilience. You get more capable. It's like weightlifting, but it's weightlifting for your stress response system. Moderate, predictable challenges make that system stronger. And that's good, because later on, when you're faced with unpredictable things, then you can manage that better. And any stressor that's unpredictable or prolonged or extreme, that makes you much more vulnerable. And it changes what we call the stress reactivity curve. And basically, the simple explanation is that as you have more external challenges and stressors, if you're neurotypically organized, you will have a proportionally appropriate internal response, which means that you'll have all kinds of access to key parts of your brain so you can think and you can problem solve and you can get through the experience, the little stressor. But if those systems become what we call sensitized, you can have a pretty simple, moderate stress, but your brain basically melts down. You basically act like you're in a life-threatening situation, when in fact it's only a minor challenge that has to do with taking a test at school or giving a presentation at work. And this is really, this overreactive stress response system is associated with all kinds of risk for physical health problems like heart disease, diabetes, and it's associated with all kinds of mental health problems like depression and anxiety, and you can anticipate, that would also put you at risk for all kinds of social and work-related problems, right? You're not going to do very well at work if every time you have a little bit of a challenge, you have a meltdown. You'll get fired. And so this shift in how controllable or not controllable something is really important. And, as I was talking about before, a lot of us sort of, because of the circumstances of our life, we've basically had a lot of experiences where we've had predictable, moderate, controllable stress. And a lot of these things are the things that are related to that. You've got stable environment, you've got a safe community, you've got a house, you've got a job. And then there are people that we work with who, for really a lot of times for no fault of their own, they've got all kinds of vulnerability. And that can come from all kinds of things, whether it's poverty or unemployment or whatever it is that, this is just some of the things that kind of put you into this category. Mm-hmm. And so then what'll happen is if during this event we're able to create some patterns of activity during this event with things that we do control, right? Now, we don't control all kinds of stuff. That's a really important thing. But we do control, like when we get up in the morning. We do control, when we take a walk. We do control the fact that we can reach out and call people. We do control the fact that we can, like your staff, they can go over and they can leave meals for kids. That is actually helping them deal with their stress. When you do something meaningful and positive for other people, you actually feel more regulated. And so all of these things can take this current situation and make it a little bit more manageable. And, if we start out over here and we do some of those things I'm talking about, we may end up right here. Now, if you start out over, if you start out here, like, you're neurotypically organized and, you start doing this, you have no daily structure and you sleep whenever all day and you get up and you eat crappy food and you watch news all day long and you get so down and depressed you don't exercise much and you just sort of implode and, all this stuff. I can tell you that even if you're well regulated, it's easy to slip into this. One day runs into another. You don't get dressed. You wear, you sleep as long as you want, and then you find that you can't fall asleep until 1 a.m, and then you start watching TV at 1, and then you binge watch till 2:30, and then you're starving at 2:30 at night, so you decide to have some cereal, and then you go to bed, and you wake up at 10:30, and your life, if you do that, you're going to get more dysregulated. So there are things that we can do that will help us and like this, and there's things that we can do that are going to make us sort of struggle over time.
And I think what you're talking about, Bruce, as we move forward with this pandemic. I mean, at first it was, okay, do this, do this, do this, and a bit of panic happening. And people were told, okay, stay home, work from home. We're now on what, week 6, week 7, something like that, where people are working from home. So we've gone, I feel like, from a phase of crisis to a phase 2 where people actually have to think about what this means. I mean, Calgary just made the decision that we're not going to, they're banning all public events until the end of August. So August until August 31st, no public events. The biggest gathering is going to be no more than 15 people. So people kind of could tolerate until April, could tolerate until May, could tolerate until June, but now we're looking at the end of the summer. What would you recommend for organizations that have to make some decisions about what they're going to do, for families that have kids at home? How would you recommend that people manage some of this stuff? It's a lot of restrictions.
Well, I think the most important thing is that the people in leadership position learn about stress.
Yeah.
And by and large, I have to say, there are a lot of good leaders and a lot of people sort of make good decisions about all kinds of things, but there aren't very many people that understand the underlying principles about what makes stress resilience building and what makes stress destructive. And a lot of times decision making by leaders unintentionally creates more stress. So for example, in education, I'll just throw this out in education. One of the things that educators really should do right now is take their foot off the academic gas pedal. Because nobody is really processing information as efficiently as they were prior to this. And so what that means is, that the normal curricular dose in any given day is too much for the majority of students to keep up with. And so they'll start to feel like they're falling behind, and then they'll get more dysregulated, and they'll be less capable of even tolerating the next dose of curricular expectation. And then they'll quit. And this has been happening all over. There's like 30-40% complete absenteeism of kids from online activities that are offered by schools. And I think it's because of a combination of fatigue in the parents and disengagement by the kids. And so I think that educators really need to change their priorities and recognize, adhere to what we talk about all the time, that you can't get to the top part of the brain and teach somebody anything until they're regulated. And very few people are regulated in a consistent way right now. I consider myself like the paragon of regulation. I mean, I'm very regulated. I'm very, and I'm pretty good with crisis. Okay. But I'm finding myself like burned out. I mean, I canceled something after this because I just said, I'm burned out. I can't do this. And which is very unlike me. But it's just acknowledging that, listen, I can't, I'm going to give a real crappy talk if I talk after this because I'm just burned out.
Yeah.
And but I think if you don't acknowledge that and kind of give yourself a break, you go in and then you create bad product, right? So I'm going to give this presentation. It was going to be a recorded presentation. I'll give it. It'll be great. Mm-hmm. But if I'd done it after this, it would have been terrible. I would have just been lethargic and less motivation. I would not have been interested in it. I just would have been pushing through.
Right. Right.
And I think a lot of people are feeling that way about their work right now, and a lot of kids are feeling that way about school. So, number one, leaders need to learn about decision fatigue. They need to learn about transitions. They need to learn about resilience building versus, sort of unintentionally dysregulating folks. Mm-hmm. And then they need to really put in place a decision-making process about change that will allow them to have the flexibility required to get to where they want to in 2 years, mm-hmm. but recognize you're going to have to go a different route. You're going to ultimately, if you take care of the people that you're supposed to take care of. Take care of your staff, take care of your students, take care of your teachers, whatever it is, and help them get through this and stay regulated and stay connected, all the other stuff is going to fall in place. Mm-hmm. But if you try to push too much on these cognitive things, like I want you to keep working at the same level, I want these papers out, I want these, I want you to do all this homework, I want you to, et cetera, you're basically going to prolong the period that everybody's burned out. And in 2 years, you won't be where you want to be.
So really, if we think about building a resilient community in spite of what's happened, that's basically what it's about, right? Maintaining that connection and really being realistic about your goals, recognizing that in the face of all of this that's happening, we may not have as much of the productivity as we did before. And in order to be able to do good work.
Well, we will not. This is not good. It's not going to happen.
Yeah. Yeah.
And the economy is not going to be as productive.
Yeah.
Academics is not going to be productive. We're not going to be as productive, but we just have to accept that. That's okay. And once you sort of get that, wrap your head around that,
yeah,
then it is in some ways relieving. And then you can focus on the stuff that's important. Just have people take care of their families, take care of themselves. And when we sort of ramp up again, with academic activity or business activity or academic activity, we'll be prepared to do it. Mm-hmm. But if we push any of these people in these systems too early, we'll just have longer periods of inefficiency. Mm-hmm. So
it's interesting. We have been recognizing that we're in this phase of this is long haul and things are going to be different for a long time. So what we've wanted to do is to create a reflective staff support group, really giving them some opportunities to be able to consider some of the ways that they're actually taking care of themselves and giving them some opportunities to connect with their cohort to be able to do that. Of course, it's online, so it's never as good as being face-to-face and having those conversations. But that's one of the ways that we feel like we may be able to get through this as a team and as a group and support our staff as much as possible. So one of the other things that I feel is a bit of a dichotomy too is that you've got all these people in the community that are bringing groceries to elderly, bringing groceries to vulnerable, making all these masks, like just people coming out and really trying to do what they can to support the community. Really beautiful. And then on the other hand, we've got the government saying, okay, so if you see a group of more than 15, you need to call it in. If you see people not standing. So we've also got that piece of everybody kind of looking to see what everybody else is doing to make some decisions about whether they should be either doing the same thing or calling it in or whatever else. I mean, it feels like a challenge for some people in a really chaotic time to manage that dichotomy of what they're supposed to be doing.
Yeah, there's a lot in our community. We see a lot of the same things. There'll be people who are really very conscientiously adhering to the physical distancing recommendations, and then there'll be people that are in the parks that are with other families having picnics, and you see people running by themselves or walking by themselves with a mask on. And they walk right by, people that are completely ignoring this. And ultimately here they had to close the parks, and which is stupid because the reality is if you adhere to the physical distancing things, the parks are awesome for people, right? You want to be able to go take a hike, right? And I know they closed Kananaskis and Banff and all kinds of stuff, but on one hand, the truth is, you need that more now than any other time. Mm-hmm. It's just that there is increased risk if somebody gets hurt or fall, something like that. So, the on one hand, a lot of the local governments in the U.S. want people to accept responsibility and not be told what to do, right?
Yeah.
But because they haven't been accepting responsibility about being responsible in parks, they've closed the parks for everybody.
Yeah.
And I think that that kind of stuff, and then because of that, then there's all kinds of people that are like protesting that, this is going too far. So, for example, in Michigan, which I think is absurd, they won't let people work in their yards.
Oh,
Which, I mean, it doesn't seem nuts. Like
yeah.
you can't have people come and help you with landscaping. I mean,
Mhm.
when's the last time you were hanging out with your landscaper? Was he breathing on you, or like, no, let the guy work. He's going to go out there. And so I think there's a lot of these overreactive decisions, in part because there's a significant portion of people that aren't responsible. And I don't know.
Mhm.
It's a weird thing. It's a very challenging thing because on one hand, there's all kinds of people who are exposed to it and get the virus. They don't have any symptoms. And
Mhm.
so that allows all kinds of people to minimize the impact, whereas other people get it and they get deathly sick, and some people die. So I don't know, it's an interesting experiment in sort of sociology that I,
Mhm.
so I don't
Yeah.
know.
So, we've talked quite a bit about some of the impact and some of the vulnerabilities and things like that. I wanted to be able to end on a more positive note. So if we think about, COVID-19 and what's actually happened here, what opportunities do you think are opening up as a result of this experience that we've had?
Well, I think the biggest opportunity is for us to basically, and you've probably heard me say this before, I think a lot of our systems need to just be blown up and reinvented. Like I think a lot of stuff we do in education is just, it's inertial. I mean, we've done it we do it that way because we've always done it that way. And
Hmm.
so I think that this is an opportunity to kind of look at, what, do we have to do education this way that we've been doing it?
Hmm.
Are there other things? Are there things that we can learn during this time that will allow us to be more creative
Hmm.
and help kids, still get academically progressed? And I think the same thing's true about mental health in particular. The idea that you have to, get in a car, drive for an hour, sit in a waiting room, come into somebody's office for 50 minutes, get back in your car and drive home to get therapy is, in my mind, is crazy.
Hmm.
I think therapeutic experiences happen everywhere. And the therapist is the person who knows a lot about sort of what's going on and why somebody does something and what might be a good way to manage this. And so if the therapists begin to think about how do I get sort of proxy therapists to work for me, the parent, the teacher, the coach, the neighbors, if I teach them a little bit about, state dependent functioning, they're going to be able to be much more understanding with Billy. And the next time he blows up, they're not going to yell at him and isolate him, but they're going to just recognize that was a precipitated, evoked behavior. And so I really do think that this is an opportunity for systems like mental health to reevaluate how they do their work.
Hmm.
I think our current system is incredibly inefficient and extremely expensive and actually minimal bang for your buck when you look at the way we spend our time.
Hmm.
And if you begin to shift the way you think about how you deliver services and understand dosing and spacing, you may get to the point where there are some kids that you work with that you realize, 10-minute check-in, you know, 4 times a week via Zoom or by a phone call is way more impactful to that child than having them come and sit with you for 50 minutes once a week.
Hmm.
So that's the kind of thing I hope that can happen, is that we can really recognize that all these systems that are kind of not ideally functioning the way we want them to function, maybe this is an opportunity to do some reinventing.
Hmm. That's great, and I think that we've heard from some families that this telehealth is actually easier than really getting in the car for half an hour and,
Absolutely. I
not
mean,
being
think about a
able to.
working family. It would
Yeah.
just be so much easier for them if Billy went off to his bedroom for half an hour, you know, at 6 o'clock at night or 4 o'clock at night, as opposed to the whole family disrupting its evening
Hmm.
because nobody's home to make dinner for the other kids. Nobody's taking the other kids to soccer. Somebody's got to go with Billy. And so everybody gets resentful at Billy because he's got symptoms and mom can't be with us because she has to drive him to therapy. I think if we start thinking about the system that Billy lives in,
Hmm.
and if we can have a light disruptive touch, we'll have more impact on him.
Hmm.
So
Yeah. Nice. Well, thank you very much. So we did have a couple questions. I hope that we've answered them. There was one question, Bruce, do you mind? Just
sure.
from a mother or a parent, sorry, who has adopted an 11-year-old, a boy who's 11 years old. And this particular child is starting to experience more behaviors that kind of disappeared for a period of time. And since this trauma has happened, and adoptive parent is very clear, recognizes that with the loss of the teacher, loss of peers, loss of, a lot of the connections that this child was having, all of a sudden these aggressive behaviors are coming up again. Do you have any thoughts or comments about
Yeah,
that?
well, there's a couple thoughts. I mean, one is that when you have, I'm just making an assumption, but
Yeah.
a lot of the kids that are in the situation of this child who was adopted and maybe came from a background where there was some adversity, they tend to have a little bit more of that overreactive stress response system. And so they're already closer to the boiling point, so to speak. And so when you add the increased background stress that's taking place across our whole culture, that may be something that's tipping him off to the point where he's regressing a little bit. The progress that he'd made before wasn't fully consolidated. That's fine, but it's going to be a temporary thing. That and again, we're seeing this not just in kids that have dysregulation problems. We're seeing this with healthy kids and kids that are neurotypically organized. We're seeing this with me. We're seeing this with adults, right? We're regressing. We're less capable of tolerating more stressors. So I think that's part of what you just be reassuring and say, listen, that whatever is regulating for this child, you might want to think about doubling the dose, right? So if this kid actually likes video games and that helps him, don't worry about him playing too much. During this time, give him more time to do his video games than you normally would. Give him a little bit more screen time or whatever it is that sort of helps him regulate. Let him do more of that, as long as it's obviously within that reasonably healthy range. And it's actually pretty expectable. It's a pretty predictable observation that somebody would do that.
Yeah. So we will get in touch with everybody that's had questions for us. We'll make sure that we respond to those questions and provide any resources. Dr. Perry has a lot of resources which we will provide for you guys that have asked the question. And I just wanted to also let people know that we're open to carry on this discussion that Bruce has kindly started with us. We feel like the community in general needs to keep this conversation going, and we'd like to be a part of that conversation and see where we can land so that we can build communities that are a lot more resilient rather than vulnerable following this pandemic. So thank you so much, Bruce, for your time. We really appreciate it.
My pleasure. Anything I can do to help my adopted home, Alberta.
Thank you. We really appreciate that.
You bet.